everyone! The title of today's YouTube video is how you can prevent infant mortality. So my name is Katie and I'm a graduate student getting my master's in public health and maternal and child health. And as a future public health professional and someone who's done a lot of the really tough research, I thought I would give you all some tips today on a topic that can be scary to hear about, but most future parents are interested in learning about. So that topic is infant mortality. And even more specifically, infant mortality in the state of Ohio, which is where I live, since this is a public health priority for the state of Ohio, as well as the nation. So let's start by actually defining infant mortality. According to the CDC, infant mortality is the death of an infant before his or her first birthday. The rate of infant mortality for the U.S. as a whole is 5.9 deaths per 1,000 live births in the year of 2015. However, Ohio's rate was quite a bit higher at 7.2 deaths per 1,000 live births. So Ohioans, we need to do a better job at getting these rates lowered. So let's learn how we can do that. So the 5 leading causes of infant death are birth defects, preterm birth and low birth weight, sudden infant death syndrome, maternal pregnancy complications, and injuries. While these causes may sound kind of confusing and you might be thinking, what in the world do I do to prevent all of this? Don't worry, we will address each of these causes. So the first cause is birth defects. 1 in 33 babies in the U.S. have a birth defect. These are structural changes at birth that can affect almost any part of the body and can be inside or outside of the baby's body. They also range from being mild to severe. These defects are sometimes spotted before birth, such as on an ultrasound, or after or even during birth. Most of these occur during the first 3 months of pregnancy, which is a critical development period for the baby. Some defects we know the cause of and some we do not. But we can start by avoiding the causes of some of the ones that we do know about. So while all birth defects cannot be prevented, here are some things you can do to avoid or increase your chance of having a healthy baby. See your healthcare provider regularly and start your prenatal care as soon as you think you might be pregnant. Be sure to get 400 micrograms of folic acid every day, which you should try to start at least 1 month before pregnancy. You can get a folic acid supplement, but you can also get folic acid through foods such as cereal that has 100% of the daily value of folic acid. Don't drink, smoke, or use illegal drugs. Talk to your doctor or healthcare provider about medications you're taking or considering taking. These should include prescriptions and over-the-counter medications. Learn how to protect yourself from infections during pregnancy. I'll attach a link below on different things that you can do to avoid various infections. If you can, try to get medical conditions such as diabetes and obesity under control prior to getting pregnant. Ways to do this would be to speak with your healthcare provider and getting on a diet and exercise plan that's going to work best for you. So I know that seems like a lot of stuff, but these are all manageable steps that you can take towards a healthy pregnancy. The second leading cause of infant mortality is preterm birth and low birth weight. Preterm birth is when a baby is born too early, which is before the 37th week of pregnancy. About 1 in 10 babies in the U.S. are born preterm. This is an area that's a little bit more difficult to prevent, but can be helped with many of the same tips as above, such as getting consistent and early prenatal care and avoiding alcohol, smoking, and drugs while pregnant and prior to getting pregnant. Other tips are to seek medical attention right away if you have any warning signs or symptoms of early labor. I'll attach a link below with these warning signs and symptoms. If you have previously had a preterm birth, you are more likely to have another, so you can speak with your doctor about using progesterone treatment during your pregnancy. Our third cause is sudden infant death syndrome, or SIDS. The definition of SIDS is the sudden death of an infant less than a year old that cannot be explained after a thorough investigation is conducted. This is the leading cause of death among infants 1 to 12 months old. While this sounds very scary, there are some interventions that you can take that have been proven to lower SIDS rates. Always put your baby on their back when they go to sleep. Put your baby to sleep on a firm and flat surface, such as a mattress and a safety-approved crib covered with a fitted sheet and no other bedding or soft items such as stuffed animals. Breastfeed your baby. Keep your baby in the room where you sleep, close to your bed, but on a separate surface, ideally for the first year, but at least for the first 6 months. Avoid smoking by you or anyone else around the baby, drinking alcohol, or using illegal drugs during pregnancy or after the baby is born. Give your baby a pacifier for naps and sleeping at night. Don't let your baby get too hot while sleeping. Follow the guidance of your healthcare provider for your baby's vaccines and checkups. Avoid products that go against safe sleep recommendations or that claim to prevent or reduce the risk for SIDS. Do not use heart or breathing monitors in the home without a recommendation from your healthcare provider. Give your baby tummy time when they are awake and someone is watching them. Our fourth list item is maternal pregnancy complications. These can be a complication with the health of the mother, baby, or both during pregnancy. Before pregnancy, you should talk with your doctor about health problems you are currently dealing with or have dealt with in the past. They may need to change how you currently deal with health problems you currently have, such as changing or taking you off certain medications that are not safe to take during pregnancy. If you have any concerns about your health, mental or physical during pregnancy, be sure to contact your healthcare provider. I will attach a link to common health conditions during pregnancy below if you would like to learn more. The last item on the list is injuries, which seems a little broad. These injuries are ones such as suffocation, which is addressed a little bit earlier with SIDS. They can also include abuse and neglect, vehicle injuries, poisoning, and others. I will add some links below about preventing child abuse and neglect, as well as how to appropriately fit your car for an infant car seat. Babies learn by putting things in their mouth, which makes them extremely vulnerable to environmental exposures such as poisoning. This makes it very important to childproof your house and make sure any dangerous substances are not within reach of your babies or young children. Now, I know that was a lot, but if you take these steps, you will cut down on the risks of infant mortality for your child and any child you may care for. Many of these risks overlap in several categories, such as getting timely and appropriate medical care for you and your child, and avoiding alcohol, smoking, and drug use before, during, and after pregnancy. That's all I have for you today. I will attach some sources that I used below, as well as all the information I referenced during this video. If you have any questions, feel free to comment below, and I will do my best to get back to all of you. Share this video with anyone who is planning on having kids, has recently had kids, helps take care of your children, or anyone you think this may help. Again, this is Katie, trying to make the world and the state of Ohio a healthier and safer place. See y'all next time.